See, my name is Bharat. I'm visiting from USA. I take you back to 1970 when you were using glass van in your lab. But today, the glass van is disposable. So that means innovation is there. But God is not going to save us. We have to save ourselves. There is a forum called healthcaregoesmobile.com, which is supported by Intel, Cisco, and you people. Even the technician can feed in with her password, non-IT, IT. So it's an open form, open source, and Intel is going to develop a PDA with a special chip which has generic name, test numbers, all over the world. I carry my file, my medical file with me all the time, even in my car, which has a report from USA, which has a report from Delhi, which has a report from Gurgaon. We are intelligent people. 80% of our people are working in USA. Now 60 plus can work in India, all the doctors. So bring them back and increase your technology. Because if we talk, then maybe another 20 years, the British will take over. Thank you.
Just a question to the lab people. When you go and take the blood samples, is there a way for you to send digitally the results to the lab back? I believe there is mobile kits are available now, and through mobile phones and things like that, you can send the things back. Is that available now?
You mean the result, the output of the...
At least...
oh yeah, absolutely. It can go on any electronic media. It can go on a phone, computer, PDA, handheld.
How much does these kits cost?
No, these are not... You see, there are two things. The sample still needs to travel to a laboratory. Now,
sample has to go to the
sample has to go to laboratory. Because less than that, these DIY things that are there are not reliable. The do-it-yourself stuff which is there, that you put a little prick of blood in front of your phone and get an output, I don't think the quality is still reliable.
Even in US, from your home, you can't do all that stuff?
No, you cannot do that. Now, what may happen in future, today we use blood as the primary media for most of the health diagnosis. Everything in human body, including hair, carries the whole human history. So in future, we could be collecting samples from barber shops, for all you know. But it is still the cheapest and the most reliable media. Maybe 100 years from now, when the E-Leaders Forum has the 150th celebration, we would be having a different domain of technology. But at the moment, the process of a specimen traveling to the laboratory one way is physical. The return process is electronic. Am I right?
Just shifting this whole technology piece into a different gear. You know, as we get newer and newer technologies and really rapidly, the costs add up because we do not have enough trained manpower. You know, the learning curve is very short. By that time somebody's learned and really good at it, the technology is almost ready to be replaced, and that's one. And the other thing is people based here, trained to take care of this equipment, because we do not have enough engineers to repair these. You know, all of them most of the times work as just telephone operators in a call center, calling the vendor and getting it done. So what is your view on that?
I think, Dr. Nambiar, this issue came up at a conference when all of us happened to be there just 3 days back. I think the biggest challenge and most understated is trained manpower in India. We gloat with the fact that we have the largest scientifically trained manpower, but our engineers, doctors, technicians, scientific personnel coming out of universities are unusable. You have to invest significant sum of money in making them usable. So therefore, I think the biggest challenge that really faces India is getting high quality trained manpower. And that is where I think the solution, suggested solution, that let Mr. Sibbal's dream of foreign universities, Indian institutions, seats of exceptional excellence like AIMS come together with Mass General and similar institutions to create human capacity. I think that is the single most critical barrier that we face in our business. Very simple if you look at it. If India has 600,000 doctors, 100,000 labs, I don't think there are 100,000 MD pathologists on the MCI roster. So something is definitely not right somewhere. Absolutely agree.
Yeah, this is a very important issue that the shortage of manpower in our country. I think we have a shortage of what's more than 7 lakh doctors as on today. And then another 15 lakh nurses and technician and paramedical. So long way to go actually. I think training is a very important activity. We need to have more. I don't know why actually we restrict admission to 50 or 100 or something like that. Why can't we allow other private sector to come and get involved into the training? I have started so many training programs, but it is not possible unless you allow the private sector to join actually. I think we need to join together. Nobody can work in isolation. So private sector, public sector has to join together for capacity building. Otherwise, we'll keep on waiting for that till long.
Can I think we have doctors. We don't have that much shortage of doctors, but more important is the mid-level, the technologists. We have definitely shortage of technologists and technicians. Rather, we don't have good institutions training technicians, laboratory technician, anesthetists, radiology technician, other things. And way back in 1976, when I went to Iran, I found we all doctors had gone from India to Iran, Philippines to Iran, Pakistan to Iran, and Iranian doctors had gone to Germany, America, and other places. But a very peculiar thing I found, that their mid-level training was intact. Their colleges were producing vocational training. They had diploma in laboratory technology, diploma in radiography, diploma in OT technicians and things like that. They had BSc laboratory technology, and this was a routine in their colleges. They were doing there, and we had excellent staff there. And I all the time was thinking that why not, same thing is here. We are just doing BSc physics, BSc chemistry, BSc biology, but we don't have BSc laboratory technology. And whichever places they are doing, as Dr. Sashi said, the quality is so poor, and we all take fresh people, and the moment they are working here in our lab or any other good lab, in 6 months they are trained like anything. So what actually is on-job training, which is important, and the facilities to be provided. And probably all these places where the work is going on, the training program should be there, education should be there. That's what my feeling.
Thank you. So before we close, actually, I think the need of the hour as well as transforming the healthcare with innovations in medical technology and diagnosis is, I think I know everybody will be having a consensus that there's a need for a need-based technology in our country. We need to have a training of healthcare personnel and an issue which has been raised. Then we need to have some sort of a self-regulatory system, or maybe a autonomous regulatory body which can bring some sort of a regulation in our country rather than depending upon the government for licensing and other things. Now, another thing is that which has been discussed as a patient safety is concerned, that the post-market surveillance for adverse effects and prompt reporting of the adverse events, that is the issue which needs to be taken into consideration. And another important is that we need to develop a culture of research and innovations, because they are ongoing activity. It is not a one-time research or innovation. So change will be there, so everybody has to get prepared for that change and accept that change. And before we close, actually, we like to have one message from each panelist. We can start from Dr. Manchanda.
My message is use technology to make healthcare affordable and accessible.
research and development should be part and parcel of every institution in the medical field. And then I will say, in the era of EBM, evidence-based medicine, we replace reliance on local gray-headed expert like me, who may be often wrong but rarely in doubt, with a systemic search for an evaluation of evidence. Thank you.
I would say that innovation is directly related to the cost reduction and, if necessary, involve technology in innovation, not the other way around.
I think I have a simpler message, sir. We need an honest India. We as leaders, I think, need to set standards. If we are honest, our down reports will be honest. So let us set up very high standards of integrity. That's all this country is missing. 90% of our newspapers are stories of scandals and scams and not of innovations. I get 12 newspapers at home. It takes me 12 minutes to read all of them. It doesn't take long. I was delighted to see the Lancet report yesterday that Lancet has come in India in a very significant way. I look at this beautiful publication from eHealth. I think let's all be honest leaders, and we will make a difference to this country.
So thank you so much, sir. Thank you to everybody who is a panelist. They have spaced their time. Now Divya can take over.